So I've shared my story with you at the beginning of the show. So if you have had a cancer diagnosis, you know what I'm talking about. You know how scary it can be. I'm very excited because throughout my journey, I have talked to so many different doctors, and there's one name that kept coming up, and that is Dr. Dan Rubin.
Hi.
With Naturopathic Specialists, and I'm so honored.
Likewise, thank you.
I'm going to try and get through this without crying, but
Same.
I really am.
Yeah.
I really am, because this journey just, takes us for a loop.
Yeah.
We know we follow conventional medicine. We don't know anything else, maybe.
Yeah.
But I want women to know that there are options and there are alternatives. First of all, you become part of our medical team.
We should be.
Right?
Yes.
So tell me, what makes your approach to helping me different?
I'm a naturopathic doctor. I'm not an MD. I'm not a DO. I am an ND. And so I am raised with a philosophy of how we look at the body, the same physiology that anybody looks at, but it's how you look at it and how you approach it, the treatments that we use, the diagnostics that we use, how we sort of narrate and dissect out your pathology report, looking at, for instance, estrogen metabolites in your body. Nobody's ever looked at that for you.
Right.
It's important,
Yeah.
especially for a woman who maybe have a family history of breast cancer. Like, these are looking at, if I may, looking at your stool, your microbiome. There are clues in the stool that can give you clues about how estrogen may be metabolized in your body. True clues.
So there are different types of breast cancer.
Yeah.
There's a lot of them. For me, I'm estrogen positive, which, and not just me, but a lot of women diagnosed end up going through a variety of treatments. I did not have to do chemo, thank goodness, radiation, but then comes the medication.
Yeah.
That we're going to take forever in some cases.
5 years or 10 years.
Yeah, and it's all very scary, Dr. Rubin. And I don't think I'm unlike a lot of other women out there who go, okay, I've already done enough to my body. I don't really necessarily want to medicate it if I don't have to.
Right.
Tell me, what is your thought on that?
Well, standard of care is to at least have those types of medications offered to you, whether it be the sort of postmenopausal one, which are the aromatase inhibitors, or sometimes the premenopausal one, which is like the estrogen receptor modifiers, the tamoxifens out there. There are quite a few women who just can't tolerate them. They try 3 or 4 of them, and their bodies they don't metabolize them well.
Right.
And it makes them feel bad. And some of that comes from the significant reduction in estrogen that those provide to a woman. So the largest segment of our population, of our patients, are women with estrogen receptor positive breast cancer. So we have been forced, in a good way, of course, to come up with protocols to help manage these people. We have a lot of referrals from the conventional oncologists. They're patients who can't tolerate, because they can't tolerate those medications. They don't know what to do with them. So we become friends with those doctors, and we're a safe place for those women to come, or a safe place for those women to come to have that discussion. And get tested and say, and sometimes I'm like, you know what, the way estrogen works in your body, you really do need to take this medication. You really do. Because sometimes it's like, well, you could take it or you couldn't based on the data.
Right. But that's, and we all have a choice, but we want to make the most educated choice possible.
About
Sounds
your
like
own body.
Yeah, you take a bit of a deeper dive into that.
Each person is unique.
Yeah.
Just because they have estrogen receptors on the cancer doesn't mean that they're 100%. What if they're only 30%? Right? And then you get bad side effects from the drug.
Right.
So then we have to negotiate that physiologically.
Because we keep getting told we need hormones in our body.
It's how a healthy woman lives.
So, but then we can't take them. So here we are.
Right. So it really does take a lot of laboratory investigation. Not everybody is fit for just plain old standard of care. It doesn't work like that.
Right.
We're not designed like that.
I appreciate
that. And so we take the N of 1 very seriously. We listen, we care, and we are open to these discussions, because this is cancer, and honestly, there's just no rules.
I appreciate you so much.
Thank you.
And I hope you do too. Here's more information. Dr. Dan Rubin, he is Naturopathic Specialist located in Scottsdale. Call 480-990-1111 or visit the website listenandcare.com.